Hello, everyone. My name is Eric Mathis. I am happy to say good morning. Just one quick second. I lost what I was looking. Sorry, one little pause. Okay, now I got it. Okay, just a few reminders today. Please use the Q&A box for any questions you have today. It can be found in the More menu depending on how you are accessing Zoom. We would prefer you only use the chat today for only the important links and for those who need it for accessibility reasons. We again prefer you use Q&A for questions, and we encourage you to avoid long discussions in the chat because they can be distracting. We will be taking a few questions during the program, but due to time, we may not get to everybody. If you stay after the main program ends, some of us stay to answer more questions. We also need you to click on the globe icon in the Zoom and select if you want to hear today's program in English or Spanish, as this will help with our interpretation. And then lastly, we want to encourage all of our speakers today to speak lower so that our excuse me um interpretation services correctly relays your words. With that, I will pass it on to the two MCs today to introduce themselves, starting with Jessica.
Hello, everyone. My name is Jessica Renner. My pronouns are she, her. I am the administrative coordinator for Self Advocates and Leadership Sale.
And with that, I'll pass it over to Emily Rogers.
Good morning. I'm so glad to see all of you here. My name is Emily Rogers, and I am the Public Policy Director for the DD Council. I'm excited to hear some great information today about workforce. Thanks.
Now it's my pleasure to have Kathy Murahashi speak a little of over the topic, overview of the topic. Excuse me.
That's great. Good morning. It's nice to be here. I'm Kathy Murahashi. I'm an older lady with blonde hair and a floral peach and black top, and I'm wearing black glasses. I use she, her pronouns. So welcome to everybody from being here. Are you seeing my screen, the PowerPoint?
Yes.
We see the
Okay.
welcome screen.
Yes.
Great. Thank you. I just wanted to be sure. Okay. So this is just a high level overview of what we're talking about today. So let's see. Okay, my screen doesn't want to go. Okay, here we go. Okay. So today's topic is workforce. And kind of with the theme of workforce that works for us. You know, we always talk about how important it is to have services and live in the community and all these things. But it doesn't happen if we don't have the people to care for us. And we call that workforce. So, that workforce is super important. We know we have a workforce shortage, not here in Washington, but it's kind of in the US as well. And it's not just one thing. It's in behavioral and mental health. We have shortages. We don't have enough people that are used to working with people, have the expertise to work with people with IDD. In childcare and in early supports for infants and toddlers, we don't have enough workforce, again, especially for folks with IDD. In our education programs, we need more special ed teachers. We need more, para educators. And in that is also that it's in school, you see, OTs, occupational therapists and speech therapists and physical therapists. Those are all part of education. Oops, it bumped for me. Hold on. In employment, we need more job coaches, people that can support people to be employed. In healthcare, we need more doctors who are trained to work with people with IDD, and nurses and other kinds of healthcare professionals that have that specialized expertise to work with our folks. And in our respite programs, it's really hard to get people to come and help in respite and recreation, and again with the specialized expertise. And then in our home care and residential settings, for people to get the support to live in their home, to get out into the community and to be part and get to their appointments. All those things are super important, and we just don't have enough of it. So what happens when we don't have enough people to care for us? The impact is we end up with people in crisis. There's people end up in the emergency room. Sometimes they end up in jail. They get stuck in settings they don't want to be in. They end up being in maybe a nursing home or an RHC where they don't want to be. And all those things cost more. When crisis costs more than just providing for what we need. And so creating and building this workforce is super important. And what needs to happen? So we need investment, and that means money, in training, in recruitment and retention, to strategies to keep people at their jobs. So, they need to be well trained so they understand our folks, and, helping to find those people. And retention means, how do we keep them happy as its employee so that they want to stay and keep working with you. The other thing, and part of that means that those professionals need to have adequate wages and benefits for their workers, because that's the kind of thing that makes them want to stay at a job. And then competitive Medicaid rates. Medicaid doesn't pay very well. And sometimes doctors and others don't want to take Medicaid because they actually lose money. Sometimes it costs more for them to bill for a service than what they would receive from the Medicaid rate. So having those rates be appropriate is really important. So that's kind of the big picture for today. Yep. And I'm going to stop sharing my screen. Okay. And you guys can go forward, and people will be talking more in depth about each of these different areas.
Perfect. Thank you, Kathy. You did a great job. Now it's my pleasure to introduce Christina Medina, and she'll be talking about the challenges in early support to infants and toddlers.
Thank you so much. And is my screen visible? Yes.
Yes.
Okay. Fantastic. Thank you so much for having us today. So I think fittingly, we're starting off with the workforce that serves the youngest Washingtonians with developmental delays and disabilities. That is the Early Support for Infants and Toddlers workforce, or ESIT. I am delighted to be joined by a panel today. So I'll try to keep my piece brief. For those of you who don't know me, I'm Christina Mendieta. I'm the Director of Public Affairs at Kindering. And then I am also joined by Sierra James, who's the Executive Director of Whatcom Center for Early Learning, as well as Sunny Luke, who is a Kindering alumni parent, and also just a fabulous advocate. So I'm really happy to have that support today. So I thought I would just talk about sort of the who and the what, and then I would leave it to Sierra and Sunny to offer sort of the why this matters from both the provider perspective as well as the family perspective. So first of all, who are we? At least today, Kindering and Whatcom Center for Early Learning, we are ESIT providers. Again, that's early support for infants and toddlers. We are some of the many organizations who are delivering ESIT services across the state. So what is ESIT?
You know what? I can't hear you, Christina. Suddenly, I don't hear you.
Oh, thank you for letting me know. Can you hear me now?
Kathy, I'm able to hear her.
I'm able
Okay.
to.
I'm able to
Okay,
hear
it just dropped off all of a sudden. Okay, thank
Oh,
you.
okay.
It might be my internet. I'm sorry.
No problem at all. So I'm just telling most of you what you already know. So ESIT services are those one-on-one occupational speech, physical therapies, and others for kids with developmental delays and disabilities ages 0 to 3 years old. Let's see. And our sort of priority legislatively this year is to focus on a policy that would basically
Now your sound did drop off.
Oh, that is inconvenient timing. Can you hear me?
I can still
hear you.
I can hear you.
Okay. I'm just going to be like uncomfortably close to my microphone. So so our 2025 priorities, basically correcting an oversight, or another way to say would be an unintended consequences of past legislative action, that basically disconnected the 0 to 3 year old early support for infants and toddlers special education multiplier from the 3 to 5 year old pre-K special education multiplier. Previously, historically, those two had been linked, which meant that anytime the sort of K through 12 special ed system got a boost, the ESIT system would as well. But since those became delinked, what ends up happening is that the ESIT system typically gets left behind when the rest of the special education system gets an increase to their special education multipliers. And so our goal this year is simply to relink those two. And I will pass it over to Sierra to talk about why this matters from a workforce perspective.
Hi, y'all. My name is Sierra James. I am the Executive Director with Whatcom Center for Early Learning. Pronouns, and I'm middle-aged with medium-length blondish brown hair. I'm really happy to be here with all of you today. It's really important for our workforce because, as you can imagine, we're trying to hire some of the same folks that the special ed system's trying to hire in the school districts, and we don't have the same resources coming to us because of this delinking. So unfortunately, this underfunding means we're struggling as ESIT agencies all across the state. Agencies have been talking about how they're having major financial and staffing challenges, and they've had to reduce their services. Ultimately, it's children and families who pay the price when services decline. So ESIT staff tend to be early childhood experts because we're working with those 0 to 3 year olds. Master's degrees that they need in order to do this work means that they often can get higher paying jobs elsewhere. So they really have to want to be there to be able to entice them into doing this work with us. They often have, it's hard, our families really want that consistency. We have kids that are having very complex medical issues going on at times, and it's really important that they have the same people coming in again and again. And so having an unstable workforce isn't very helpful for those families. So, what we're talking about today is the legislative strategy. There's a hearing today in the House Appropriations that um, is about 5263. Our goal is to ensure that the final version of this bill retains ESIT in the bill. At the moment, it is there, and this relinking that Christina was talking about is there, but we just need to keep it there. We fought really hard to get it there. And who supports this policy? You know, the ARC does, and all of you, thank you. ECDA, which represents ESA agencies all over the whole state. Kindering, who Christina works with, Wacom Center for Early Learning, Bright Spark, Children's Alliance, and Northwest Center, and so many others that aren't listed there. We really, everybody working in this field across the whole state feels like this is very important.
You're up.
Thank you for the opportunity. I'm passionate. I'm a mom, and Kira is my 20-year-old daughter. Her going to kindering started with me finding kindering. At the start of her life, she was gravely ill. We knew she was going to have developmental delays. And we found a hub that was able to direct us and help us identify our needs for her so that we could help support her. When you're floored and you're devastated, you want to isolate yourself. You're not looking at the person you need to help. We found kindring through asking questions. And when I was reliving the situation, I remembered it was our pediatrician that led us to kindering. We had a great group of people that came in-house, watching my daughter in her natural environment, and we had a family counselor. I think it's crucial, it's critical. The link up should be cemented. It should never have been separated. I did not know that this was going on. 0 to 3 are the formative years. A child's development, if you really look at it, from the time they're born to the time they're 1 year old, they do so much. It's incredible. My daughter wasn't doing anything, and I wasn't looking for where she might not develop, but I had a team that came in, and kindering was the hub for us. Kira was offered a great opportunity because now she's at the transition program, and she volunteered at kindering last year, her first year in the program. And they respected her work as a volunteer. It was like Kira went home. And I'm passionate about this. We should not be leaving children behind. We should be helping them. And when they get into school, the 3 to 5 year program, you're going to be in a classroom. I know that Kira was with gen ed students too. And then if your staffing is lax, then you're not going to be looking out for the individual needs of all these little ones. Kindring did that for us. They earmarked some of the things that she wasn't doing that maybe they could help her. They told us where we could get more therapy or look at what she might need. And it helped me because it was rescue, not recovery. And you want to fight for this. I'm really passionate, and I'm blind too. So I wasn't disabled when I started this journey. I knew that there was a chance that I might be, but it's kept me focused. It was hope. And now that I know that it's more important for me to look toward the future for those that are here and who might be going through this. If you can't look, you won't find. How do parents know that these services are there? And if we don't get the right people in to support the services, how are we going to get the help that these special people need?
Thank you so much, Sunny. I really appreciate you. I'm both you and Sierra coming on short notice to present because I think it's important to show kind of the impact, both from the provider point of view, we're trying to keep these programs open, and then really from the family point of view, your story is very powerful. So thank you. And Kathy, thank you for putting the link to signing in pro on that bill, like in real time in the chat. I really appreciate it. I think we're probably at time, but I do see a hand up. Are we able to take questions or should we wait till the end?
I think we have a minute or two for a question. So I think maybe one question. Tammy has her hand up.
Hi. I don't have a question. I just wanted to say I am also passionate about this because I was a recipient of this program. I could not talk. I had cerebral palsy after the diagnosis at 3 year old. I'm now in my 50s, but I have been a success story of your program. Back then, it was called the Lower Schoolhouse. But because of that, I went on to be mainstreamed, went to college, had a family. So yes, it's very important. Thank you.
Thank you. And I remembered that you were an ESIT graduate, but I didn't know sort of like the rest of your story. So thank you.
Great. Thank you, Christina.
Yes, thank you.
Oh, and if anyone wants to get involved, I do have on the screen my email, but I'll also put that in the chat in case anyone wants to connect specifically with us about our advocacy efforts. Although the ARC has been such a fabulous partner, I'm sure you get all the information you need from them.
Now it's my pleasure to introduce our next speaker, Katina Davis from Project Echo. We'll be talking about training in professionals.
I think Katrina's not here, but I think Dr. Gary Stobie
Yes.
and Ben Moore are here to talk about the Echo project. So thank you so much, and it's all yours.
Thanks, Kathy, and thanks everyone. Yeah, Katrina is in another meeting, actually doing trainings. So we're filling in for her. Ben Moore is with me. Ben, do you want to say hi?
Hey, everybody.
All right.
I mean, literally, hi. I'll let you take it over and describe it, Gary, because I feel like you would do a much better, job explaining the basics on what it is, whereas I will probably ramble.
I'm gonna call on you during one section. Kathy, am I able to share slides?
Yes, let me do that for you. Hold on. Let's see. Okay, you should be able to now.
All right. Let's see. Can you guys see my slide there?
Yes, it's up.
Thank you.
All right. So those of you that don't know me, I am a neurologist by training, so a doctor specializing in brain conditions, and I'm considered a specialist in the area of neurodevelopment, things that affect people in their childhood and continue to affect them into adulthood. We recognized that early on, like 20, 30 years ago, that there was a growing number of individuals, people that were living in the community with conditions like autism and intellectual disability and other conditions. And we mistakenly thought that we had enough specialists to help everybody access medical services and access help help manage mental health conditions and other things that were interfering with their quality of life. We launched the Seattle Children's Autism Center in 2009, and we quickly learned that we were wrong. We didn't have enough specialists. So that's when we turned and we focused on helping support primary care providers and other healthcare providers like nurse practitioners, pediatricians, family practitioners, to be able to help work and serve and treat conditions that co-occur in the neurodivergent population. And we use, you can see here that we have a number of programs now that we have wrapped into what we call the Include Collaborative. And Include stands for the Interdisciplinary Network of Community Leaders with a focus on the underserved and disability education. And this is we use most commonly a method of support and training for our healthcare providers called the ECHO model. And the ECHO model is a way that we can teach using individual cases to learn from. So we all get in a Zoom room and a person presents their patient, the person that they're serving. Um, they don't use their name. They don't use where they're from, so they're de-identified. And we all learn, and then we at University of Washington and others that are so-called experts from different lived perspectives. So I might be a neurologist, we might have a speech therapist, and we really value our family advocates and self-advocates that are also experts and bring their lived experience to the hub team and to giving recommendations. Ben Moore with us today is an example of one of our hub team members, very valuable member. He wears his lived perspective hat of being neurodivergent and brings that perspective. We thank Ben because he comes in with all these providers, and sometimes we say things that can be upsetting to people, and we value everybody's willingness to learn and to have open minds in these discussions. It's really exciting place to come. If you've never been to an ECHO meeting, please contact me or Ben afterwards, and we'll invite you because we think it's a very rich environment to learn. Ben, you have anything you want to add to that from your perspective of participating in the hub team for some of the echoes?
Yeah, thanks, Gary. I feel like it's very important to get that self-advocate perspective. One thing that a lot of the advocate and the self-advocate and the parent perspectives, a lot of us already work in healthcare, and so we also have that additional knowledge, like Gary said. Basically, yes. Echo particularly, the motto there is all teach, all learn. I mean, it's not just, I mean, we're all experts in our own rights. Some of us with more letters after our names than others. But it's a great chance to, get out there and network and all that sort of fun stuff. So I will put my email in the chat, and you can either get a hold of me or Gary if you're interested. Thank you.
Thanks, Ben. And networking is exactly one of our big goals because we recognize that we need the community, and we recognize that no one can do this by themselves. Everybody benefits from having community, including our healthcare providers and our service providers benefit from having community. And often people in rural areas or socioeconomic disadvantaged areas, often people that are providers feel isolated. And We are working hard, often at lower rates, to see Medicaid families. And so this is an example, this map, of just the our COE network and our Echo Resources network. So this isn't even all of the numbers that have joined our network, our Include Collaborative. The centers of excellence are the medical providers that have gone through training to be able to diagnose and treat autism. And we have ability to link you. If you're from one of these communities and you want to get linked, let us know. Send us send us contact afterwards. And again, check out our website at wainclude.org. And you can register for one of these echoes if you want to join. And again, if you have any problems that you're having, reach out and connect with us. And I'll stop sharing a screen now and open it up if anybody has any questions.
Any questions from anyone?
Okay.
All right. Thanks everyone for your time. We appreciate it.
Thank you, everyone.
Thank you for coming. It was very nice to listen to you.
Great. Thank you very much.
And our next speaker is Jessica, introducing the next speaker.
Our next speaker is Dimas Nesterenko from SCEIU, who will be speaking about building the individual provider network.
Good morning, everyone. My name is Dimas Nesterenko. I am representing SAU 775. We're a caregivers union. I am also a parent provider. I'll explain you why I'm parent provider. I adopted my older sister from Ukraine in order for me to bring her to United States. And I'm still her parent on papers, and I'm a full caregiver, provide care for her. So I do understand the intent and how complicated in-home care services can be, and why we need to continuously support caregivers to provide all of these services we can get. And I think in 2008, when our state was going through recession, there's a lot of questions was asked, like if we're going to sustain the program or not, if there's going to be significant cuts or not. The same question is asked right now, unfortunately, and hopefully we're doing all of our best to convey legislators. There's no cuts should be happening in long-term care services. You cannot cut essential services, especially healthcare services. And long-term care services are part of healthcare services. And the legislators need to realize that if you're not going to pay caregivers to provide in-home care services, those clients will end up going to hospitals, and it's going to cost even more than paying for the services. Luckily, our state is one of the states who fully supports caregivers, including higher wages. And I'm not saying that's enough. And starting wages at $21, unfortunately, in this economy, it seems like a lot, but it's not. Especially if you live in the city of Seattle, it's nothing. In order for you to survive, the study shows if in Seattle to rent a studio, you have to make at least $37 an hour. So you see the difference, and prices are going up. Another factor, I think, what helps to keep workers in the workforce, healthcare benefits. And I think, Kathy, you mentioned in the beginning of the program that how is essential and important healthcare. So insurance. I'm originally from Ukraine. I moved to the United States in 2008. And the first shocking moment for me was learning that healthcare, it's not human rights here. It's a privilege, unfortunately. Expensive privilege that actually comes with, if you get sick, be ready to pay a lot. That's what I learned. And not all of the employers do offer healthcare benefits, unfortunately. And what we've seen through the other states, as soon as you start providing healthcare benefits and providing really good social benefit package, you tend employees sticking in the workforce. Is it said? Yes, it is that you have to provide, you have to give those benefits in order to make a job more attractive. I think the healthcare benefits should be human right. You should not you should not seek a job that provides healthcare. You should seek a job that you enjoy doing, but also healthcare benefits should be human rights. And we are working hard with legislatures to make sure we keep those benefits because those are benefits crucial for our members, for caregivers. And we cover about 22,000 caregivers out of 50,000 caregivers we have in our state. It's a huge amount, especially the type of benefits state provides, full coverage, dental, medical, vision, and health. And we're going to do our best, I promise, to make sure it's not questioned and no one's asking, should we get rid of or should we make some cuts, because it is crucial for the workforce and for caregivers network. Another part we're working to make job easier for caregivers is someone who already in the force, making background checks, ongoing background check. This is not something that if you want to become a caregiver, you have to go through several background checks, federal, state. We are not talking about this one. It's the background check I'm talking about ongoing that caregivers required to do every 2 years, which is unfortunately can be complicated process, and especially if you live in rural areas and you have to drive far away to take your fingerprints. And I'm not sure why we do need to take fingerprints, because fingerprints do not change. Like when you've done it once, and I think it should be good, and you just need to do every 2 year, every other year, just a name and date of birth search, which is state can easily do without your presence. But unfortunately, as of right now, the law says even if you're enforced and we know you're cleared, you still have to do background check that they can 10, 20 years ago. And unfortunately, targets people of color and immigrants because a smaller violation in like 20 years ago, you forgot your driver's license, so you use HOV lane, and you had mobile home without proper insurance, you got some sort of criminal record, which it's not disqualifying crime. And so we don't want this. This is follow our caregivers and stop them from providing care, because in order to resolve, you have to pause, you have to you're not getting paid. I'm sure some of you have stories, because the reason why we started working on it, because we heard so many stories that people been delaying with getting paid, some of them been 4 to 5 months without pay, and unfortunately you're not getting those money get back. So we work with our stakeholders, with across the line, Democrats and Republicans, to craft a policy that still keeps safety of our clients and provides easier access through background checks for caregivers. So right now it's a bill 1395. The bill passed the House last week, and right now it's in the Senate. And I hope that there's a potentials for the policy get out and passing and making life easier for caregivers, because, caregivers are already doing extremely hard work. It's not an easy job. I'm going to be honest with you. I know, because I provide care, and I provide care to my family member. Imagine if you're providing care to a non-family provider. I appreciate it for the work you do. And if we can make it easier and without actually taking you away from the care you provide, we're here. And I'm happy to get your feedback, because that's how we make the great policy and best policy, when we all provide a feedback and craft the best policy from what we can do. But again, we have to make sure safety of our clients is priority. It's number one. Happy to answer any questions. I know I have only 5 minutes, and I hope I was able to cover under 5 minutes.
Great job.
The bill is that bill, the background check bill 1395?
1395. I'm gonna put it in the chat.
I'll put it in the chat now there.
It's
wanted to be
scheduled
sure.
for public hearing on Friday in Senate Healthcare Committee. Would be great if you sign on as a pro. Again, that policy, we work with Republicans and Democrats to submit several amendments to make it even more clear that safety is priority number one. And second, we want to make sure caregivers don't have to go through those loopholes and for like every other year. I know for myself, for fact, every other year I have to go and take fingerprints. And I'm sure some of you have similar stories. Thank
Thank you
you.
so much.
Next speaker is Scott Livengood from CRSA, who will be speaking about workforce challenges in supported employment.
Good morning, everyone. Scott Livengood. I'm the CEO of Alpha Support Living Services. We provide residential services in King, Snohomish, and Spokane counties, and I'm one of the legislative co-chairs for CRSA, and I'll be speaking about workforce challenges in supported living. Let's see if I can share my screen. Okay. So just a little bit before I get started, I've worked in this field now for 33 years. And when I was first hired in the field, I worked as a direct support professional, part of a team helping individuals move out of state institutions. So I do have experience in that position, and then working my way up to the position that I have now. So DSPs is the most challenging work role that I ever performed in this field. So I think it's one that deserves our respect. So a little bit about supported living, and then we'll move on. So supported living is the residential setting where individuals live in their own homes and then are supported by direct support professionals contracted through an agency with DDA. It's a full range of services, from personal care, behavior support, to medication management, behavior support, community integration, all aspects of the person's life. Typically, it's 2 to 4 people living in an apartment or home, but it can be some single person homes, which is typically due to complex behaviors. There's around 4,600 individuals served in supported living across the state, which is a mix of supported living, which I just talked about, but also group homes, group chaining homes, children's residential, and community protection. So the level of care in those settings is similar to the acuity level of those served in SOLA programs, state operated programs, and the RHCs. So to compare the three settings, community residential serves by far the most, about 4,600 currently, which is over 87% of the individuals served across those three settings. The state operated served 226, and RHC served 448 as of the last report. But as you can see, the average daily cost per client is significantly different across the three settings. Just over $600 in supported living, over $1,300 per client per day in SOLAs, and over $1,600 per client per day. And we're not saying, this is not our position to say they're overpriced, they're overfunded. What we're saying is supported living is underfunded and deserves the same level of respect for the individuals working in those settings. Because what that results in is turnover that's 30% lower in the other settings. And the other thing is funding definitely impacts the individuals being supported. So what we saw when our funding fell way behind the cost of living for a number of years, the individuals being supported in this setting decreased significantly, and the number of vacancies increased. But then we received a larger increase back in 2022, and you'll see then the numbers start to tick back up. And so we're really back up to where we were prior to the pandemic because of those investments. So what's needed? A rate study was done because all of us have been talking about wages is one of the big workforce issues. So a rate study was done by Milliman a number of years ago and sent back to the legislature, which at that time was based upon 2022 data, which said supported living is underfunded by 10%. Our costs that we pay out are 10% above what we get from the legislature and Medicaid. Since that time, we've lost further ground. So when we first came into session, we were looking at a 19% difference. Obviously, the landscape has changed significantly with the budget forecast and the huge deficit we're seeing. So now what we're trying to get is just a cost of living adjustment to match what the solar programs are getting, which is 3% in the first year, 2% in the second year. That does not wipe away what the rate study said, but we realize we'll need to come back in another legislative session to try to address that. The other thing that we've seen, and the rate study did point this out, is that individuals being served in supported living, which is a crisis-driven setting, have become more and more complex. About 50% also have an accompanying mental health diagnosis. And a lot of that is because it's those who are in crisis, stuck in hospitals, moving out of RHCs, out-of-state placements, Western state, Eastern state, who are being referred, rising to the top of the referral list. So it's been more complex, and the rate study said that there should be some sort of add-on payment to supplement what supported living providers get so that they can get the workforce and retain the workforce to provide that support. This is similar to the complex needs pilot that was done last year. So getting into a lot of numbers, I will try to winnow this down to make sense. But supported living is funded on a tier level. Essentially, those that are, levels 1 through 3 are individuals that don't need 24-hour support and are able to maybe have someone come once a day or a couple of times a week and provide support. As soon as you get to 4, 5, and 6, they require 24-hour support, but are able to share supports with a housemate or two. As soon as you get to levels 7, 8, and 9, those are individuals who need one-on-one 24/7 support and are typically single-person households. So what you've seen over the last 8 years is a huge shift to having more and more complex individuals being served in supported living. You'll now see that the top tiers, 5 through 9, have gone from about 27% of those served to now nearly 60%. And the number of people living in single-person households nearly triple in just an 8 years' time. So you add that to underfunding, low wages, and now serving more complex individuals, it makes the workforce challenges even more significant. There's approximately 14,000 direct support professionals across the state of Washington. Most work more than one job, which makes the workforce issues even more challenging, because not only are you, trying to hire individuals, but you're also navigating schedules with individuals who work 2, sometimes 3 jobs. Turnover in supported living has hovered around 50%, 7 of the last 8 years. And even though the average turnover in supported living decreased, the last survey that we got down to 37%, we did see that the average provider level turnover was 49%. And I know that's getting into statistics and data, but what that really means is turnover in smaller agencies has been higher. So it's also had huge swings across the state, and you'll see some of the turnover rates by county have gone from 30% all the way to over 100% in Benton County. So even though we've seen some increases, we're still seeing that starting wages is somewhere in the $20 to $21 per hour. And as Demos previously presented, that's not a livable wage. It's still 27% below livable wage and 99% below for a family with 1 child. And so we need additional funding to try to address this issue, which is, across supported living, but also adult family homes, individual providers, a number of settings. So that's a little bit of information, just checking to see if there were any questions.
Thank you.
Thank you.
Any questions? Okay.
Oh, pardon me, I have one in the chat. But I can read it.
Okay.
Scott, for those in the higher tier levels who do best living alone, are there any feasible innovations in housing that would allow them to share supports?
I know a number of developers have recently been looking at trying to do some sort of shared resources, whether that's getting away from these single family homes into duplexes, triplexes, larger settings, so there can be some shared resources. It's really challenging when it's a single person household standalone. So you can't have an emergency response if something were to happen, or other resources when someone calls out sick or is on leave. So I know there's been some creativity around trying to have more of those shared resources across multiple family settings. And I don't want to steal her thunder, but there's also some around remote supports. So Peggy will talk about that.
Next speaker is Brandy Schultz from CEA, also speaking about workforce challenges in supported employment.
Hello, can you all hear me okay?
Yes.
Wonderful, thank you. So thanks for having me here today. My name is Brandy Gerda Schutz. I use she, her pronouns. I'm a middle-aged woman with mid-length hair and glasses, and I'm here today to talk about supported employment. And I represent Compass Career Solutions. I'm the Senior Director for Compass. We provide supported employment and community inclusion services in Washington State, in about 9 different areas of Washington. And then I'm also the board president for the Community Employment Alliance in Washington. And while I'm realizing everyone else had great data, and I wish I had data to give you today, I do want to talk generally about the critical issue that is it affects our workforce, and then it ultimately affects individuals receiving supported employment and community services. And that's the workforce shortages we have in employment services. And then, of course, like I said, that impact that it's had on people with disabilities who rely on those services to secure and maintain meaningful employment and be integrated parts of their communities. Across Washington, we're facing this challenge in hiring and retaining skilled employment professionals. As I'm sure many of you know, the work that we do in supported employment is not just plopping somebody into a job. We're fostering long-term success. We are ensuring stability in jobs. We're providing all the necessary supports needed so that people with disabilities can thrive in the workforce and thus thrive in their communities. But the reality is that our ability to deliver those services is compromised by the difficulties of recruiting and retaining employees. An example that I have, that's just one example out of many, is a person that we work with in Spokane. We provide supported employment supports to that person. They work at a detail shop. They've worked at that place for many, many years. They've become a valuable and reliable employee. But recently, the management of the detail shop came to us and expressed frustration. The frustration is not at all with the employee, our client. The frustration is with us because our high employee turnover has created inconsistency in support, which makes it difficult for both the employer and the employee, our client, to navigate the workplace successfully. And this, like I said, is not isolated. This happens across our communities. So we do everything in our power at Compass, to make sure that people continue to receive the services they need. In many cases, what that means is our leadership and our management are stepping in to provide direct supports. And we do that because we're committed to doing whatever it takes to make sure that people are getting the supports they need and keeping the jobs that they have and keeping the connections that they have in their communities. But what happens is this creates a domino effect. And while leaders are filling service gaps, there's less time to focus on recruiting, on hiring, on retaining the employees that we desperately need. And this just becomes a cycle, and it makes it even harder to build a stable and effective workforce, which in turn limits access to services for the people that need them the most. The people that we serve have the right to consistent, high quality employment support. And we're struggling to meet that need due to the workforce shortages. I believe if we want to see real change, we need to advocate for solutions that attract and retain professionals in this field, which means we need competitive wages, those benefits that we talked about, career growth opportunities, and the recognition that this work is essential to creating inclusive, thriving communities. I believe we need policymakers, we need businesses, we need community leaders to understand that when workforce shortages limit our services, they limit opportunities for people with disabilities to fully participate in their workforce and in their community and in the workforce at large. This isn't just about staffing, it's about honestly civil rights, it's about economic empowerment, it's about inclusion, and it affects us all. So I believe we work together, we build stronger, more sustainable systems that not only ensure that people with disabilities have the opportunities and supports they deserve, and it strengthens all of our communities. Like I said, I don't have the data, but very similar to what Scott just shared. The turnover rates in our field are off the charts. We have some areas where our turnover rates last year were 200%.
Oh, she's muted.
I think you muted yourself.
I did mute myself. Thank you. I was just saying, just similar to what Scott shared in turnover rates, we experience the same type of rates. We have some areas where our turnover rates are as high as 200%. And when we aren't able to keep employees long-term, we're not able to train them and sustain them and again, provide those quality services. So for us, I don't have a specific bill I need you to promote. What I need you to promote is no cuts to Medicaid and no cuts to community services for people with disabilities.
Thank you so much. I think there we go. I think our next speaker is Peggy DeSalle from Safe at Home.
Thank you so much, everybody. So great to hear everyone's stories and presentations. I wish we could do this more often. I just love this type of connection that we get within our community. I'm going to share my screen really quick and share a very quick presentation with you so that I can teach you all a little bit more about remote supports, which is a very overlooked service in the state for people with IDD. We are a DDA provider, so if anybody is on a DDA waiver, this service is offered to them through the waiver system on the IFS waiver, the Basic Plus waiver, and the core residential and non-residential waiver. We're happy to always, partner with our supported living friends and help support everybody in the best way that we can. So remote supports is really about connecting people to support when they need it, and then yet supporting their privacy when they want that. It's the least restrictive way to support somebody. And we're going to watch a quick video, actually, that DDA created. It's about a 2-minute video, but it just speaks 1,000 words that I couldn't do. So let's take a look at that. Oh, wait, I got to share my, hold on. I forgot to share my sound. Give me 1 second. All right. Can you all hear that?
Get help when you want it with remote support. Do you want to be more independent at home or in the community with technology support to help keep you safe? Reach a person who can give you reminders to do things throughout your day using a video call? Get alerts that remind you when it's time to take medication or finish tasks around your home? Have virtual support and supervision to be more independent when you don't need to have someone there with you? These are just some of the ways remote support can assist you in addition to other care you receive, giving you more freedom and peace of mind. Remote support is one of many waiver services, and it's included in the Individual and Family Services Waiver, Basic Plus Waiver, and Core Waiver. Ask for remote support or any service of the DSHS Developmental Disabilities Administration by using our online service and information request form, or by contacting your DDA case manager directly by phone or email. Even if you are not enrolled in a waiver program, you can still ask for a service, and your case manager will walk you through the next steps. If you aren't sure what words to use, just say what you need, and your DDA case manager will help find the services that work best for you. This is about creating a great life that looks the way you want it to look. Any words you choose are the right words to use. To learn more about DDA's other waiver services, visit dshs.wa.gov/DDA/WAIVERS.
Oh, my goodness. Why is it not letting me move forward from that? There we go. Sorry about that. So you might be asking yourself, who is a good fit for this type of service? Well, anybody that would benefit from, daily support check-ins that helps them, like it said in the video, with reminders, medication reminders, hygiene reminders, clean your apartment reminders, let's get you out of the house on time for work reminder, did you pack your lunch for work, that type of thing. Anything that they would need a reminder for, we can certainly help them with. Anybody that craves social interaction, a lot of people that frequently call 911 just to have a human to talk to, we can divert their attention to us and keep those resources open for people that need them. Anybody that's just looking for that, that human to human interaction, especially since, COVID, so many more people are isolated and just need that human to human connection. And we are able to offer that. As we mentioned earlier, it's, anybody that needs help accomplishing their ADLs on a daily basis without, hands-on help. Anybody that doesn't need, help getting dressed or anything like that. Anything that doesn't need hands-on help, we can help with. We also go on the job with people all the time. We are there to support people while they're in the workforce. If someone, maybe gets a little anxious while they're working and they just need to step away and have someone to talk to, we do that all the time. We've gone to college with people. We've been in transition with people. It's just been a wonderful, wonderful way to support people remotely. So these are some of our solutions that we offer people. Like I mentioned earlier, medication management, we can use technology to help support that as well with like medication dispensers, and then couple that with a check-in reminder on their tablet. We would usually issue someone a tablet so they can have that human to human, face-to-face connection with someone. We offer overnight support. let's say they are in a supported living setting but only get daytime support, we can help offer overnight support to those individuals. Visitor safety, we use things like video doorbells. They can see who's outside their door without ever having to open up their door and have have communication with anybody outside their door without ever having to actually open the door. Kitchen safety, we can help people with heat alarms and things like that. If burners are left on or ovens are left on. Elopement, we help with seizure management, fall mitigation. There's many things that we can, many solutions that we can offer people. And it's really helped transforming the lives of individuals. It helps them, exercise those independent muscles, but it also gives families peace of mind that they are supported on a 24-hour basis. So they have access to us 24 hours a day, 7 days a week, and then we can check in with them once or twice or 3 times a day, however many times that they need. This is not for emergency only. This can be, like I said, for social interaction. If someone has anxiety and they just need someone to connect to talk to. Also for case managers, knowing that their people are supported around the clock. This is my contact information. I will also put my my phone number and my email in the chat. I would be happy to talk to anybody that has a scenario that they would like to discuss with me. And I can, reach out to you. We can do a very, brief consultation and determine if this is a good fit for either yourself or the individual that you support. And so thank you. We can leave it open to any questions if anybody has it for just a minute or so. Any questions?
I have a quick question. I am wondering if the support you offer, you said you offer a tablet. So then is it like FaceTime where?
Yes. Yes.
Okay.
So the tablet, I should have turned it on, but it's a regular good sized tablet. They can have just a face-to-face conversation with our remote support staff.
Awesome. Thanks.
And then also we have a GeoComm. This is just literally a portable little cell phone. This is what usually people take on the job with them. And then if they, need to step away, they can just press this button and get connected immediately to our remote support staff, even while on the job, or if they're on, their transit system, going to and from the job, and maybe they get off the wrong bus stop or whatever, they would have an immediate connection to someone in our remote support center.
Thank you. Such a great way to think about growing our workforce in a different kind of way. I think that it's a really great support for our workforce.
Thank you.
Force.
Thanks, Kathy. Appreciate being here. Thanks, everybody.
So next on the agenda is Deanna Winterrose, Benton, Franklin Parent Coalition, I'm sorry. Talking about the family perspective.
Great. Thank you so much. I'm here to talk about some of the challenges that families face when they are looking for providers for their loved ones. Finding a provider from those currently trained and looking for work is incredibly difficult. Many of our families have loved ones who are difficult to care for. The providers need to be physically fit, able to run, able to take a blow, and willing to do so. Often our clients don't have access to speech or haven't yet mastered alternative methods, which can lead to intense behaviors when their communication methods aren't understood. Many of our families need care nights and weekends, yet these are the times that providers want to be home with their families. When compared to elder care, where the providers can often watch TV or do a puzzle with a client, one can easily see why providers gravitate towards those less demanding roles. Despite this, we sometimes do find a friend or a neighbor or family member willing to be trained to be a provider. Yet once they agree, another set of barriers exist when trying to onboard and access the required training due to communication issues between DDA, CDWA, and SEIU training. The lack of personal and timely support to work through the issues between CDWA and SEIU has actually caused people to quit before they even accomplish their training. Those that do hang in there often fail to complete the required training within the allowed timeline due to these issues and are forced to suspend care until the necessary coursework has been completed and the classes become available. Solutions have been provided and even adopted. In 2023, a new category of providers, that of family provider, was enacted. These providers were only required to have 35 hours of training with no continuing education requirements, compared to those with 70 hours required to become a licensed home care aide and the 12 hours of continuing education required each year for that role. Families were thrilled that now grandparents, aunts, uncles, cousins, and other family members could get on board and help quickly. Unfortunately, this program, designed to acknowledge the lifelong relationship and firsthand knowledge these providers bring to the table, was ignored in legislation last year. In Senate Bill 5811, it was passed and it now allows family providers to take up to 12 continuing education credits per year. And in 2027, those 12 credits will become mandatory. The problem with the requirement lies in the fact that SEIU's Learning Library does not provide the content to supply 12 continuing education credits year after year for those caring for their loved ones with intellectual and developmental delays. It also ignores the fact that most of these caregivers have learned what they need to know from a lifelong relationship with the person they're caring for, often learning directly from their providers when accompanying them to their medical and therapeutic appointments. While we recognize the value of having access to training when it improves care, taking coursework that isn't relevant or specific to the person's needs only serves to amplify the costs and create barriers for care. In the current financial climate, we can't afford to lose these providers when we're already facing shortages, nor can we afford to throw money at training that won't directly benefit those being cared for. The logical solution would be to allow the family providers who could benefit from the continuing education to access that paid training, while not requiring training from those providers who don't need it. I hope that you'll join me in advocating for a change to this requirement. One last thing to watch for. It's likely the full 12 continuing education credits will have to be budgeted for in the current budget. Even though they're not mandatory this year, they've still got to cover it because they say that it's allowed. This would likely mean cuts in other areas, likely DDA services. Even if we can get the continuing education credits reduced or removed in the future, or allow them to remain optional, reestablishing the funds that will be cut for it to take place this year is going to be a difficult task. Happy to answer any questions.
So Christine in the chat box asked, how do we change this? Is there a bill on this? Do you want to give that information?
I do, Christine. I'm glad you asked that. There is not currently a bill. We were told that a senator had agreed to put an amendment on a bill, and that was supposed to have happened last week. And because it didn't, we have missed the essential cutoff dates for this session in order to be able to run a bill that is just specific to this topic. So our hope is to be able to get that set up for next year. Or there's a possibility if we go into special session, we could have something ready to go there where new things can be proposed. And we're also reaching out to see if it's something that could be done by way of proviso, but that's kind of a reach. So I will definitely keep this group posted if it is something that we are able to pursue this year. But for the time being, the avenues that we've been told to follow this year have proven to be unsuccessful.
Thanks, Deanna.
So, so next on the agenda, I don't know, I haven't seen, is Terry Hansen here?
Don't use the windmill, you just make.
No.
No?
Jessica, were you going to speak?
Yeah, go ahead, Jessica.
I don't have anything.
Okay.
Okay.
All right. We're a little behind anyway. That works.
So then we'll have Kathy Marahashi to go over the bills of interest.
All righty. A lot going on this week. There's a lot of hearings happening and a lot of bills. Last week, a lot of bills died, but this week, a lot of them are moving forward. Let me share my screen a little bit. Let's look at the bills quick. I think this is the one. Are you able to see that?
Yes.
Okay. So here is what is happening. The 1390, that's repealing the Community Protection Program. That bill has passed the House and is moving over to the Senate. It does not have a hearing yet. So we're going to watch for that. We're hoping to see that happen soon. Okay, here's the big one, guys. Last week, Senate Bill 5393 had a hearing in the Senate Ways and Means Committee. And then today at 1:30, House Bill 1472 has a hearing. And what do those bills do? They would close the House bill today would close Yakima Valley School and Rainier School. Those are residential habilitation centers. And, for a lot of reasons, we support that. So if you are interested in, we're encouraging people to sign in today for 1472. Let's see, so can somebody put maybe the link to 1472 in the chat box to sign in? That would be super helpful. If not, I'll do it in a minute or two. So that's a big deal. That hearing is at 1:30 today. So you'd need to sign in prior to 1:30, an hour before 1:30. And if you want to testify, at least an hour before. So that's a big deal. 5680, the establishing the right to repair, that bill is moving forward. I listened to the hearing yesterday. It was very interesting. It was all pro. Everybody was signing in pro on that bill. So that was good. Although there were some of the wheelchair dealers was trying to kind of push back on part of the bill. But it looks like that it's probably moving forward, which is great news. 5501, concerning employer requirements for driving. That bill had a House hearing last week, and it has an executive session. Let's see, I think Friday at 10:30. What that bill does is it says, if you're advertising for a job and the job does not require you to drive as part of one of its tasks, it's not the essential part of your job, they cannot require that you have a driver's license. They could require you have a state ID, but they can't require you to have a driver's license. And as you know, many of our folks with disabilities are unable to drive, and that's a big barrier for them to require driver's license when it's not essential for the job, right? So that's good. That's good for a lot of people, I think. Education, today, let's see. Yesterday, 5253 was heard in the House Education Committee. That extends school to age 22 for students with disabilities. That hearing went well. 5263 today also has a hearing at 4:00. That was the bill that Christina talked about. That's kind of all about it's a broad bill that incorporates a lot of problems within special funding for education, special education, and it includes that birth to three piece. And then it also includes things around the multiplier. There's a lot of things. So if that bill is important to you, yes, thank you for putting that into the chat box. You can sign on to that bill as well. Or the hearing again is at, let's see, on the 19th or today at 4. The House Bill 1217 was about housing stability, eliminating rents. That bill has a hearing today at 1:30 as well. If that's important to you, that's 1217. Yes, let's see, Monday, 11:30, the concerning waivers, prioritization of waivers was heard. And so that one seems to be moving along as well. 5394 is being heard today at 1:30. That bill reduces the for people on what's called the no paid services caseload. That means they're not getting any services that are paid for from DDA. It eliminates their case management. So basically, they're just going to be waiting and not have any connection to the community. So if somebody can put that bill in the chat box as well. So those are our big bills for this week. Like I said, there's a lot of hearings. You can see, let's see today, let's see if there's any others today that I missed. Let me make this bigger. View. All righty. Today is Wednesday. So there it is, the housing stability bill, the closing Yakima Valley and Rainier School bill. There's also a bill 5079 addressing the burden of unintentional overpayments on older adults and adults with disabilities. Those are people that are on the aging, blind, and disabled program. That just get a little bit of it. It keeps them on Medicaid, and sometimes they get paid too much. They don't get a lot of money. Sometimes I think it's really a low amount, maybe $200 a month. But if they get paid an extra payment, then having to pay it back is difficult. There's the no paid services caseload and the special ed bill this afternoon. There's an that bill has this executive session tomorrow on turning 22. And then the background check bill 1395 that Demas talked about is on Friday at 8. Okay, I'm going to stop sharing. The only other thing I want to say is, we're working on both fronts here, and to continue to connect with so these are our state legislators, our Congress. There are threats to Medicaid. We continue to ask you to call your congressional delegation and tell them to prevent cuts to Medicaid. And, there's a lot of things happening there. I'm going to hold on, and I will put in the chat box the link to our Medicaid Matters page. And you can go there, and a lot of people are sharing their stories. Let's see, Medicaid Matters. Okay. I got to put in the chat box. There you go. There's the Medicaid Matters. So if you would like to share your story, you could just send a picture and a statement. You could do a video, whatever works for you. We're really encouraging as many people to share their stories as possible. We use them when we talk to congressmen. We use them on social media. So please keep up the pressure. Last week we heard, they did a continuing resolution. That means at the federal level, they said, we're going to extend the budget that we already have until September. But there's also some cuts built into that. But that means we have in some ways, have some more time. To advocate for protecting Medicaid. Okay, and
Kathy, I have the wrap up for Advocacy Day. That's it.
Hey, go for it.
This is Jessica. Today's topic is about how we can create a quality workforce everywhere so people with disabilities can receive the quality care they need to live in the community. The summary on our one-pager states, Washington faces a critical shortage of professionals with the experience and training necessary to support individuals with intellectual and developmental disabilities, IDD. This shortage affects all systems, including behavioral health, child care, education, respite, early supports for infants and toddlers, ESSET, local, community programs, mental health, and residential services. How do we get a quality workforce? As our speaker stated, we need to make sure our workforce are paid a living wage. We also need to make sure workers receive a high level of training and have access to get licenses that keeps them in those career paths. We also need to have different specialized paths because there are so many kinds of disabilities and specific needs and requirements. We encourage you this week to reach out to your legislators about the topics you heard today and the program and services needed. We all need to succeed. I will add again, it's very important to reach out to all of our legislators to educate them about our issues. Sharing your personal stories is one of the best ways for your legislators to get to know what you need. For more information about these and other issues you learned about today, I'm going to post this week's one-pager in the chat. Also, again, please see the ARC's bills of interests. With that, I will thank everybody for coming today, especially our great speakers. A few of us will stay for a few minutes after if people have questions, and remember, change is made by those who show up. Thank you.
Thank you, Jessica. And before you all leave, would you please take a moment to do our poll? I will do that now. And then I will also put it into the chat box. You can also do it, go to the link and do it there and that one is also available in Spanish. There you go. Thank you. Thanks to all our speakers. Great work.